Let's talk about a patient and show you some improvements that we have made for a patient that has come in with what I suspect is breast implant illness. There's no direct test that I can pull to find out if that's what's going on, but we can pull other markers that will either show us inflammatory load, histamine load, a CBC panel, one of the cheapest panels that you can get, can really show a lot of different things. As you can see, I'm going to pop up, I have a spreadsheet here of when we started doing blood work with her. She initially had blood work from a prior provider in, looks like September 24. I pulled my initial blood work with her in April of this year, and then we had follow-up in July. So you can see here, globulin has definitely started to improve, and now we have that in functional range. It was pretty low last year in September. You need your globulin to be up. That's part of it, plays an important role in your immune system. AG ratio looks good. Vitamin D she has brought up exponentially, so that's doing much better. That's going to help decrease her inflammatory load. I always want to see, I mean, hers is maybe a touch high, but I'm okay with 93. It's better than somebody walking in, as I often see on blood work, like a 20. So, but always between 70 and 80 if you have an autoimmune or an autoimmune process going on in the body. Vitamin B12 has also gone from 425 to 698. So that is going to help with detoxification. We have the homocysteine. White blood cell count has gone down, but she's on a medication for a couple of different things which can trend that down. Her neutrophils have really started to balance out. Lymphocytes, eosinophils, you can tell that there's still a little bit of a histamine response going on there, but that also looks so much better. Now, one thing I will say on this last one, I keep noticing that her ALT is low. So that's one of your liver enzymes. And when it's lower, it just tells me we're out of functional range. So 10 to 26 is where I would like it to be. Her AST is great at 15, but her ALT just remains low. So that tells me that she may have a slightly sluggish detox pathway going on in her liver. So that's something that we're actually focusing on this last time that I followed up with her. In CV, down in the CBC panel, we were at 94 the first time I tested for her. Now we've gone back up to 96.9. That's the size of the red blood cell, and can also kind of lean me towards, are we detoxing properly? Is methylation where it should be? So you can see here where we have definitely made improvements. She's feeling a lot better. She's not having the eczema outbreaks that she was having. So you can see it works.